the MTX disease monitoring and control application is an online portal and messaging system, and it provides an executive summary dashboard for quick access of disease and symptom-related data from the community. It also provides a list of individuals that require monitoring for disease infection or possible symptoms. And it also allows us to follow individuals who have come in contact, or healthcare workers who have come in contact with those individuals. And then lastly, it provides a digital self-quarantine messaging system that is a non-invasive survey. It sends these surveys to individuals, and it asks them questions around symptom progression over a period of time. So we'll highlight these key areas in the demo. I'll put out a disclaimer that all data that you will see in this demo is fictional. It is not real data that's used to track any coronavirus cases, and we are demoing in a demo environment, so this is not production information. All right, take it away, Andrew.
Thanks, Myra. Go ahead. So the application initially presents with an executive dashboard that allows you to get the state to get a quick look overall at what's going on in the state. Counties can see this dashboard limited to their county as well, or local health departments can. They get an idea of the new items that have come in, the new passengers or travelers that have come in from the Centers of Disease Control at the airport that they've sent them, an idea of who's pending, how many they're monitoring currently, and how many have been monitoring discontinued. Those are primarily people that are monitoring complete because they've been through the 14-day period already. And then down in the middle there, you could see currently we're looking in our demo data at 3 people being engaged with no symptoms, which is great. We're going to go ahead and look at new here, and we're going to take a look at this list. So this is the list of just the people that are new that the health department has done nothing with yet. They have a quick way to go through and eliminate candidates from taking a look at if they know that someone hasn't actually traveled, the information's not there appropriately, or if the person is already under investigation. But we'll pick this one character, Alex James, and open them up and look at their data. So as we look at the information that they have there, the initial application that we're looking at is being able to engage them, to set their disposition to monitoring, and then send them out a consent message via a text message. So using the guidelines that the CDC set up for how to do the texting, someone would actually need to contact them first via phone or physically and say, is it okay if we monitor you via texting? And then they would send this out to them to record that data that they have been given permission or consent has been granted from them. As you can see, the message comes through, and then they're able to actually see this on the application side as well as to what's happening. This will change the dashboard to say if they've got people pending consent, as well as to see if someone has gone ahead and approved consent. Once someone has approved consent, excuse me, once someone has approved their consent, then the system will go ahead and send out requests. In the case of New York State, starting around 9 or 10 a.m., it'll send a message out 4 to 5 times a day if it doesn't get a response, like every hour or so, asking what you see here. Since we last contacted you, have you had a fever, cough, shortness of breath, diarrhea, or felt ill? And this would be the message that this particular health department decided was the best thing to ask, just to get a quick answer. If they say no, it's great. They won't hear from them again until the next day, and after a 14-day period, they'll be thanked for participating. If they say yes to that answer, then it will mark them as someone who is not only engaged as having answered, but is also symptomatic. Once they say yes, they're prompted with a very brief form, and they'll be able to fill out that form to provide follow-up information that's provided. We'll see that in a second here as we go through. And again, we're keeping the questions fairly simple here because the primary focus right now is engaging people who had not had symptoms yet, determining when they have symptoms, and then they fall into a different category. Then you start to get into the lab work and medical care with them. So in this case, the person replied that they did have symptoms. It's going to go back. We're going to see on our executive dashboard that now we've got someone that is symptomatic. More so, we could see the conversation as it goes back and forth. So again, looking at the executive dashboard, we now have 3 that are engaged and symptomatic. Going through from there, we can open the person up, decide how we want to proceed with it. If the health department contacts them, they determine that it is not corona, it's something different, they may decide to continue monitoring them because they were still exposed. They may take a look at the follow-up information, of course, to see, and in this case, the trying to keep the questions simple. The state's looking for what the temperature is and has any anti-fever medicine been taken yet. They may put this person under investigation. There we go. So we're seeing that we put them under investigation for their disposition, and now's the time when the test will be sent out. We'll be working with the clinic. We'll be working to see what the next step is. And you can see at the bottom, we've got our person under investigation now to 2. And the county can monitor that, as well as the state health department has this information without having to send spreadsheets around or paper processes, manual processes that they're doing.
Great. Thank you, Andrew. We did a pretty high level overview. There are additional features that are coming up. For instance, we have a heat map, which is a map of the state that shows the hotspots, exactly which counties are receiving the highest cases of the virus, which areas are being monitored, which areas have persons under investigation, and then which areas have been safe. So you can really track the disease in real time and see where exactly it's spreading regionally.